Good morning. I'm Dr. Aisha Khalid, and I'll be your host for today's Quiet Echo. I want to tell you about a patient named Claire. Claire is not her real name. Dr. Ilana Uekiewicz, an oncologist at Stanford, used a pseudonym to protect her patient's identity when she published an essay about her earlier this month in Stat News, a health publication. I am using the same name she used. Claire had curable cancer. She is dead. Uekiewicz asked her to follow up, but her first available appointment was months away, so Claire waited. And while she waited, she went looking for answers the way most people do at 2 a.m, when they are frightened and cannot reach anyone with the authority to tell them what is happening in their bodies. Instagram told her to cut sugar to starve the tumor. A podcast recommended ivermectin. Politicians she followed stirred regret over vaccines she had received decades earlier. By the time Claire got back to her physician, she had been in the misinformation ecosystem long enough to lose the window the treatment required. Uekiewicz writes, "I lost her to the void of poor access. Quickly, it was filled." I want to talk about the void this morning, because I think Cedar Valley needs to understand it is not an Oregon problem or a Stanford problem. It is the condition of primary care in this country right now, including in Cedar Valley, including in my practice. A typical primary care physician carries 2,500 patients. Studies suggest caring for all of them adequately would require 27 hours per day. The math does not work. It has not worked for years. Electronic records require more than 5 hours of documentation for every 8 hours spent with patients. Insurance authorizations take another dozen hours per week. The result is a system where the first available appointment is often weeks away, where the standard visit is 15 minutes regardless of what the patient brings, and where the physician who would catch the thing early is simply not reachable when early matters. What fills the gap is not silence. It is Instagram and podcasts and neighbors and search results and chatbots and politicians. Most of it is wrong. Some of it is dangerous. All of it is available immediately, at no cost, at any hour, to anyone with a phone and a frightening symptom. I want to say something honest here. Claire's death was not solely the system's failure. She made choices. She followed advice she should not have followed, but she made those choices inside a gap the system created. The void existed before the misinformation filled it. Uekiewicz does not excuse the system by blaming Claire. She holds both. So do I. I have practiced medicine in Cedar Valley for 20 years. I have had patients come back after a long absence with something I wish I had caught sooner. I have had patients tell me carefully, quietly, what they had been trying while they waited. I have had patients I could not help because by the time they reached me, the window had closed. I know the void Uekiewicz is describing. I have stood at its edge. I have lost people to it. I cannot fix the structural problem this morning, but I can give Cedar Valley something practical to do right now. And I want to, because I do not want to be the physician writing about the void without telling you how to keep it from filling. When you cannot get an appointment and the symptom will not wait, say so. Do not accept the first available slot months away without telling the office what is happening. Call back. Ask to speak to a nurse. Most practices have a nurse line for exactly this purpose. A nurse can triage. A nurse can determine whether you need to be seen sooner. The system has a pathway for urgency. You have to name the urgency to activate it. If the symptom cannot wait for primary care and urgent care is available, use it. Urgent care is not the emergency room. It is designed for the space between a symptom and a scheduled appointment. It exists because the gap exists. When you do get in, tell your physician everything you found while you were waiting. The podcast, the neighbor's advice, the supplement, the thing you read at 2 a.m. Your physician cannot help what she does not know. The conversation is harder if she is working with incomplete information. It is harder still if the misinformation has had months to shape what you believe about your own body. And if you have been putting off calling at all because you assume the appointment will be months away anyway, because you do not want to bother anyone, because you have been telling yourself it will probably go away, call anyway. Name the symptom to someone qualified to hear it. Let the triage happen. Let the system do what it is supposed to do when you give it the chance. Uekiewicz closes her essay with something worth sitting with. In the middle of all the noise Claire encountered, a chatbot said something accurate. You should see your doctor. The problem was not the advice. The problem was the door was not open when she needed it. Cedar Valley cannot open the door for the whole country, but Cedar Valley can knock on it, hard, and keep knocking until someone answers. If you have been sitting with a symptom and a question you have not asked out loud, or if you have been unable to reach your physician and are not sure what to do next, the Cedar Valley News Facebook group is where the conversation continues. You are not the only one. I will put the link in the show notes. This is Dr. Aisha Khalid, your host for today's Quiet Echo. Thanks for listening. This Quiet Echo is part of the fictional Cedar Valley News series, written by Evan Swenson, publisher, publication consultants, and Claude Marshall, AI developmental editor. While the people in town of Cedar Valley are fictional, Dr. Ilana Ueck and her essay in Stat News are real. Claire is a pseudonym used by Dr. Ueck to protect her patient's identity.
You've been listening to the Cedar Valley News Podcast, where small-town voices meet the headlines shaping our world. From faith and family to front porches and fields. We'll be back with more stories connecting real lives to real events. Until next time, keep your porch light on, your faith strong, and your heart open. This is Cedar Valley News.